Transition's a really hot topic at the moment, but it's one of those kind of words and descriptions. It's really not clear. Tell me about it. Define it for me.
Yeah, I think the biggest problem is a lot of people think transition is just transfer, is the event of transfer, when actually transition is far more than that. It's about managing change at various points in somebody's lives. It's about developing skills, particularly to manage their own healthcare, developing independence, developing self-advocacy skills. And within that then, the event of transfer over to adult hospital, settling into adults, and then defining themselves as an adult to be able to manage their own healthcare and have a wider life. And I think within that, vocational skills in terms of career and career aspirations, such big topics that are lost. And we have so many youngsters who transfer into adults and have little or no aspirations because people don't grow that with them. Their lives grow, but their aspirations don't.
What are some of the challenges, do you think, from your experience?
From my experience, I think sometimes it's the clinicians will be very interested in their health and not their wider life, whereas I'm more about their wider life, and their health is a part of that, but the clinicians will cover that. As I touched on, vocationally, there's not enough work experience, there's not enough opportunities for youngsters to get out and try roles. They write themselves off, as do the parents, write off their own youngster because they don't think that they're amount to much, and there's so much potential that it just doesn't get unleashed and is not out there. So there are agencies like Plus and Remploy, but people don't know to contact them. At the job centre, there are work coaches that can support people, but they're not very knowledgeable.
Okay.
So you might go to one of them, have a poor experience, and that's it. Write off your potential there. And I think our role is great because we can at least signpost and support people, whether it be into national support groups or local support groups.
So what, if I were to ask you what advice you'd give to a family, what would you say?
I think helping your youngster to understand about their own body, learning to cope with living with a long-term health condition doesn't mean you write off your life. It means about finding strategies to help them cope, teaching them skills. It may not be the way that you do something that they have to find a different way to do the same thing. It's about giving them the confidence to ask their own questions in clinic and allowing them space to see doctors on their own, not be worried about what they're going to ask. The parent can then go into the consultation and be part of it. And also, the young person, if they're encouraged to feedback, you can actually see that your youngster has a really good memory, that they're able to recount what the doctor said and show the skills that they're learning to look after themselves as well.